Good afternoon, everybody. Happy May. It is May 1st today, and this is our COVID-19 briefing time for Eau Claire County. We're pleased that people are again joining us to hear updates, to learn about what is happening in the community related to COVID-19, and to share this information broadly across the community as well. It is May. It's hard to believe that this month has come, and we are looking forward to a good weekend ahead. Again, I was reminded yesterday, walking my dog after a long day at work. I was on the trail nearby the courthouse here, and happened to run across a friend and the person that cuts my hair. Lots of social media about quarantine hair going on, but it's a real impact on real businesses when small businesses are struggling. And Shawnee reminded me of that yesterday, the importance of doing this right, not only containing disease and doing all those things that make a difference to contain disease, but also to make sure that we are reopening in a safe and strategic way in this community and communities across the state. Always important for every one of us to remember the broad implications of what's happening in our community. An update in Wisconsin, we have 72,566 negative tests for COVID-19, 7,314 confirmed cases by testing for COVID-19, an increase of 460 since yesterday. 1,544 hospitalizations, about 21% of people with COVID-19 positive tests being hospitalized at some point, and 327 people in our state have died of COVID-19, an increase of 11 people. State capacity for testing continues to be a critical priority. We just got off a phone call a few minutes ago related to that increasing testing capacity and how local health departments and local response efforts work together with the state on increasing testing capacity. We do have more ability to test in the state, and we need to continue to have the resources to actually do those tests. Testing is increasing across Wisconsin, but more work needs to be done about that. A strong partnership with Exact Sciences is one of the ways the state is working on testing increases. They are also making sure that testing supplies go out to locations across the state when they have access to them. We will be working with them in the future on a newer initiative around testing within vulnerable populations in certain sectors where we know disease can make an enormous difference. So today they talked a bit about the opportunities to do that work locally as well, and we'll be exploring that as we hear more. We also got more information today about their efforts around contact tracing. They have a whole team set up to really move to that number of 1,000 new contact tracers in the state. Again, critically important that we all understand how important, as we start reopening, it will be to contain disease, to not only do testing, know who is positive, but also contain disease by making sure that people that have been in contact with an individual that's positive stay home so that we can be sure that they also didn't get the disease and are spreading it. Contact tracing work is happening in Eau Claire as well to make sure we're building the ability to contact trace all those individuals that have been connected to a positive case in our community. In Eau Claire, we now have 34 confirmed cases of COVID-19 from testing. That's an increase of 6 people from yesterday. We are doing case investigations for all those increased 6 individuals today and calling those contacts like we do for every case. Those positives are obviously a big increase for us today. We do know that some of those positives are from connections to an existing case that we are aware of. Others we are continuing to investigate. It's complicated work to do this. Each case means that we are looking again broadly at who they've been in contact with. And if there's someone that's been out in the community because they're doing essential work, because they have other reasons to be out, they have many more contacts. And so our team will be spending a lot of time today and tomorrow and through the weekend making sure that those people are aware of the situation and are staying home for their quarantine time if they are a contact. Our testing numbers, 2,104 individuals that are Eau Claire County residents have been tested. 2,013 of those are negative. The rest are pending. And as of today, or as of this week, on the 27th, actually, we're checking that once a week. 20 of those cases of the 34 are considered out of their isolation period and are no longer considered infectious. It's that time that they needed to stay home. They were isolated, and they have completed that time. Again, we'll be updating our numbers related to cases that have completed their isolation once a week as we are able to do that. We are expecting more cases. We've said that before. We know that as more people are out in the community, as we have more community spread, that we will get more cases. It's not a surprise to us that there are increased cases. We need to continue to test to know who is a case and then do the work to keep the number of spread from that case small. That's what we mean when we say containment. We need to keep the disease spread as low as possible. Again, it will be a critical part of the work we do moving forward. On a very positive note, yesterday, Hipsch Services, a local company, made a very generous donation of 5,095 masks to our effort in responding to this disease. N95 masks are a special mask that we use in situations where there's very close contact with someone that has COVID-19 or is presumed to have disease. Critically important for our healthcare and first responder partners to have that. The donation will really help in Eau Claire keep us safer and keep us healthier. So an enormous thanks to Jim Vaudrey and his team at Hipsch and his commitment to our community in that donation. Our call center continues to be busy. We average more than 150 calls a week. My understanding is the last couple of days those call volumes have increased. We will be here this weekend for calls, but and I'm sorry, we are not going to be here this weekend for calls. We have decided to have Monday through Friday call center availability. This weekend, we will be checking messages and following up with people because the volume of calls has been limited. But we will be back on Monday fully, 8 to 4:30 to answer calls of the community. Again, a really good site to go to get your questions answered is the coronavirus.echealthdepartment.org website. If you haven't been there recently, do go back and look at it. There's some really clear information there, accessible in a new way, a new format, and finding it will be a better experience, I promise. We are still awaiting the results of the Supreme Court case that is in existence that is arguing the order that is currently in place. We have not heard anything about that at this point in time, but that certainly will have implications as we move forward. We continue to do all the work that we need to do locally to ensure that we are reopening successfully. So do know that that's an important part of our efforts. We mentioned on Wednesday that regional testing will be happening in partnership with the National Guard. Those testing sites have been announced as of this afternoon. We have the full information on all of the testing sites that will be happening across the region. The first National Guard associated tests are happening today in Alma, as I mentioned on Wednesday. Eau Claire and Dunn partnership to have testing done here will be on May 10th and May 11th. We will get more information out to the community broadly about those testing dates and times. On Sunday, May 10th, it will be 8 to 5, and on Monday, May 11th, we will have testing done between 11 and 7 p.m., 11 a.m. to 7 p.m., to account for people that may need evening testing. That will be happening in cooperation with our Prevea site. Really huge kudos and thanks to the Prevea team for being willing to partner with us, and to the National Guard for being willing to work with the region to increase testing. It is an opportunity to have people that have symptoms, low-level symptoms, to be tested and to get results on those tests. It's also an opportunity for us in this region to understand where we are at with positive cases. We are anticipating that we likely will get more positives from that blitz of testing. About 100 tests can be done each day. So people that have COVID symptoms that may have either screened themselves out of testing or for another reason not gotten tested, please consider participating in that testing opportunity. The National Guard will be here in Eau Claire just for those 2 days, but all of our testing sites across the area are doing an enormously good job of getting testing to happen. We just need more tests being run. Again, for that testing opportunity, there's no need to be connected to a provider, and there is no cost. So we encourage people, when they see the information, to share it broadly in their networks, and we will be getting out more information very soon for that to be shared easily. On Wednesday, you also heard updates about the Chippewa Valley Economic Recovery Task Force, an important effort that's happening in our community to really focus on how do we support businesses across the Chippewa Valley in recovering successfully, both from a health standpoint, knowing how to make sure that they are opening and being in a place to keep people protected, but also the important work, as Dale Peters mentioned, about revitalizing and energizing the economy. That group is moving forward. They met today, the leadership of it met today to really flesh out who would be in different roles, and I anticipate to see good things happening from that group. The COVID-19 response team that has been working in Incident Command will be supporting that effort with the science-based approach to making sure that best practice happens across our businesses. That work has already happened. We are working with business and industry and all kinds of sectors now to answer questions, to provide resources. We get regular information out. We have on our website a business section that is full of really good information, and we encourage businesses to go now to that site, to the website, and start looking at strategies and resources to be ready for reopening in a smart and strategic way. Our safety officer with Incident Command is also available to go out and meet with businesses to really see how to best set up things so that we engineer safety into how we move forward. The world's going to look a bit different. We know it already, it looks different, but how we do our business work and our service industry work will look different for a little bit so that we protect people when they are out and about. So please go to the coronavirus.ecehealthdepartment.org webpage and start pulling that information if you haven't already. Again, the overall goal is to reopen soon, to reopen strategically, and to be smart with that reopening. Along the same line of keeping people safe and healthy, we know that this disease has been particularly hard in congregate settings, those settings where people live together, long-term care facilities, assisted living facilities, and those kinds of spaces. We are meeting weekly with those institutions and answering a lot of questions and providing best practices there. We have an amazing team of professionals working in long-term care and congregate settings across this community, and we should all be really appreciative of that. Disease is happening, though, in those settings despite the best intentions across the state, and we know it's a matter of time before we have those challenges as well here. The state is working very carefully on supporting efforts in those kinds of settings. I mentioned earlier, testing is one of those things that they will be helping us do more completely, and we're looking forward to that opportunity when that happens. The state recently, as we said Wednesday, has released more information on their website about outbreaks that are happening in those settings, and that's a start at providing information at a regional and state level about those situations. It continues to be critically important that we protect our vulnerable populations, so we are continuing to support making sure that people stay safe in those settings. We know it's hard on families. We know it's hard on all of us that have loved ones in those situations, and we really encourage you to find creative ways to reach out, creative ways to connect despite this being incredibly difficult. We also, newly, the state has put together a web-based tool to do self-assessments by long-term care facilities to really make sure they're planning in advance how, when disease may come into their walls, how they are making sure it doesn't spread. So we're really fortunate that we have an infection preventionist nurse that has worked for a long time from our health department with long-term care and hospital settings for infection control. And she has already worked with those institutions on these kinds of assessments. Many places are doing it for the first time, but in Eau Claire, we've had that asset available. So we're fortunate, and we will be continuing to use that self-assessment tool as we move forward. The weekend ahead, we know that we have some nice weather, we think, coming this weekend, and we know it's fishing opener, a reminder to people that are out and about this weekend enjoying our beautiful state that it is okay to travel to do those recreational activities. It's good to enjoy those recreational activities, but remember the basics. Stay with your household, maintain physical distance when you are out and about, and really, if you're ill, stay home. Out of the abundance of precaution, make sure that you are not out if you are ill. It's also Census Awareness Weekend, not just fishing opener weekend. Remember that it's a census year and it's important to be counted. Respond by mail or by online at mycensus2020.gov so that you can be counted. It's critically important that that happens. Nearly 50% of Eau Claire County households have already responded, but we need all of you to do that. So pay attention to the communication that the census is sending out. We benefit as a community by having us be counted. Funding from the state comes down, and from the federal government comes down based on our census numbers. And it makes an enormous difference in everything from having money for loans, having money for our roads, having money for hospitals and emergency services. And it helps our elected officials make decisions. So before COVID, we were making sure that we had lots of ways to outreach to people individually and supporting them in filling out the census. Obviously, with COVID-19, some of those services have been challenged because of not being able to come in close contact. But our health department knows that having good census data makes a difference, whether it's for housing reasons or some of those programs that we know make a big difference to support our residents. We also know, because of previous work to COVID-19, that some of the top health priorities in this community, including mental health, substance use, and alcohol use, those priorities that come from our data, are in existence in this community. Those priorities are things that we've been working on for years, but certainly the last couple of years have bubbled up as health priorities that in partnership across the community we've been working on. In COVID-19 times, those challenges, mental health, substance abuse, and alcohol particularly, are ones that we all have to pay attention to. It's a disease that has stressed people even more. It's a disease that may impact the use and misuse of all kinds of substances. We know from data that's been shared across the state that, for example, alcohol sales are up. And we're encouraging people to find healthy ways to deal with the stress with COVID-19, to really think about the mental health toll that is happening in our community and reaching out to individuals and supporting one another in making sure that we are responding to this really unprecedented situation in ways that are healthy and supportive to one another. A reminder, and again, you can find this information on our website, but a reminder that the Hope Line text service is available across the state, and that is texting to Hope Line and then 741-741, or contacting 211 for services, or texting for information from 211 to 898211. So remember, for you, get good exercise, good food, sleep, pay attention to your mental health, and look out for that for others as well. So, a reminder, again, the website, coronavirus.ecehealthdepartment.org. Our call center number, 715-831-7425. We'll continue with our Monday, Wednesday, Friday schedule for our media updates, and I'm available to answer questions now. Yes?
Lisa, can you talk a little bit more about, if you know it yet, what might work with vulnerable populations look like?
So, can you be a bit more specific about the work with the vulnerable populations?
I'll try.
Yeah, the testing work. Okay. There's lots of different things that we're doing related to vulnerable populations. So the question is related to what are we doing related to vulnerable populations, particularly to the testing issue that I mentioned. The state mentioned today, so this is new information, that there is interest in reaching out and doing some additional testing with vulnerable populations, particularly elderly and those that are living in congregate settings. So we are interested as a community in doing that. We will be working with the state to see if increased testing can happen. Right now, typically testing in a long-term care facility, for example, happens if there's a positive case, and then testing happens with the other people residing in that situation. We see value in going out and doing some testing in advance of that kind of an outbreak situation. So we'll be exploring that with them. We are doing many, many other things with vulnerable populations right now. So there's a lot of work happening with those experiencing homelessness. There is work happening to support individuals that might not otherwise have easy access to information. So finding new and creative ways to get good information out to various populations, and a number of other ways that we are working to make sure that all people in this community not only can know what they should be doing to stay safe, but also can receive the services that they need, whether it's testing or treatment services, or for those experiencing homelessness, basic housing. Yeah.
We've heard some questions from readers who are curious if there's any plans at this point to have an American Sign Language interpreter or translator here.
Sure. So the question is related to having an American Sign Language interpreter available at the briefings versus having what we have right now is text added to our briefings so that people are aware of that. We are working with an American Sign Language interpreter to provide that information after the briefings happen, so having it added in as a screenshot behind me to those existing briefing that are available. So that is up and available on our website as a resource and is something that people can link to. Not real time, but right after we have someone that's available to do that, which is an amazing resource for those people that need that. And we have also, Valley Media Works has been working with us to have the text option available as well for people that want to do that. Yes?
It's kind of a two-part question. First of all, the 6 for Eau Claire County, is that the biggest increase that Eau Claire County has seen since it started? And the second part of the question is, last several days we've seen larger increases statewide that you guys have attributed to larger amounts of testing.
Mm-hmm.
Can you maybe comment on when we should maybe start seeing those numbers not spike up maybe quite so high, and so we know it's like not maybe a concern?
Sure. So some questions really about testing and what we're seeing with testing increases, what we might anticipate with testing over time, and the results of positives with testing. We did have, I believe today, our biggest single one-day increase of 6 cases, and we're not surprised by that. Is quite truthful for all of you to know. We know that as we have increased opportunities to connect with others because we are out in the community, we will likely see increased positives over time. So that is not a surprise. We expect that our numbers are not going to go down anytime soon. We will continue to see our numbers increasing. So that is not a surprise. And at a state level, as increased testing happens, we will also see an increase. So yes, that is true. And we are seeing increased testing also happen. So the largest single day increase of testing in Eau Claire County happened yesterday. We had significantly more tests being submitted. So as we see more tests submitted, we will likely also see more positives. And because that happened a couple of days ago, those results are landing today. We want testing increases to happen. One of the measures that we look at is our positivity rate, of the tests that are done, what percent of those are positive. And so the positivity rate will stay about the same if our test numbers go up as well as our positive numbers. So really our overall look is at the positivity rate, not just at the increased numbers. Yeah.
Can I stay on testing but revisit the vulnerable populations?
Mm-hmm.
The idea of testing more of those folks, is that going to be hindered somewhat because of the shortage of testing supplies and other hurdles that I and others have written about?
Mm-hmm. So the question is related to as we have a goal of increased testing, and in fact the state goal of 85,000 tests a week being done is a goal. That is what we are targeting, and it really is there because we need to have a good understanding of disease in the community and the ability to contain disease. We only can contain if we know if we have it, so we need testing for that purpose. What are the barriers to doing that, especially with the desire to test those people that are more vulnerable, like I mentioned earlier? The state has worked very hard on testing capacity. It is still not perfect, and the challenge is, of course, the supply chain for testing. We are not the only state that wants to increase testing. We're not the only country that wants to increase testing. So the demand on those suppliers of the testing materials is intense right now. We have seen great increase as the weeks have gone on. Remember, this is brand new disease. We are only 5 months into this really as a country. And really it's been the last couple of months that the intensity has been ratcheted up considerably. So the fact that we are getting more supply, that Exact Sciences, as an example of a company in Wisconsin that has produced thousands of test supplies already, is a real tribute to the ingenuity and the commitment that we have in the state. But we still have gaps, and that is absolutely true. There are places that we are working on, the swabs, we're working on the PPE. So those are all things that are happening now. There's a new system in the state now for those people that are doing testing to submit their requests for supplies to the state asset and get those free. So the state is really working hard to pull in any supply chain that they can and then distribute that out to all of our testing sites. Still far from being perfect because the suppliers are still catching up, but much better than what we've seen, and the increased number of tests being done in the state is really an example of the progress that we've made.
I know recently you said that Eau Claire was able to do 40 to 60 tests here daily, but that just ramped up, which is what we saw.
Yeah.
How many?
So the results from the last couple of days, we've had 2 days that have been over 60, but it's fluctuating, and we know even during the weekend that will change again. But we did have a day where 120 tests were done in a day, and another day where there were about 60 tests. So we are starting to see slowly an increase of testing here, and that's the capacity that we need long term. Again, the National Guard will help us a lot next weekend, but they're here just for 2 days. So our healthcare providers that are really increasing their ability to do testing are critically important. In our incident command meetings, they have reported back to us that they are doing that they are finding ways to increase testing, and a whole clinical group will be starting testing, we think, next week, that they announced today to us. But that's going to be important to make sure that long term we have the ability to test. Yeah.
A couple questions about the National Guard testing. For both of those days, May 10th and 11th, going to be at a location in Eau Claire. Did you say that there was going to be 100 tests available each day, like 100 tests per day?
Yeah, so the question is related to the National Guard site, supported site in Eau Claire. That site is at the current Prevea drive-through testing site on Claremont Avenue. That will be the location. It will be broadly announced and publicized, but the ability of the National Guard to do testing is about 200 tests per day. So I incorrectly said 100. 200 tests per day by the National Guard, and we're hoping to fully use their capacity when they're here. So our hope is that we have that many tests done each day when they are here in Eau Claire. That location on Claremont Avenue, the Prevea drive-through location, again, we will have lots of information out for people, and we're hoping people take advantage of that. Yes?
Again, the folks that just want to make sure the message is clear, because there's this growing message for wanting people to get tested. You're saying if people have symptoms, right? I mean, if you feel well, you're not asking people to get tested.
So the request right now is for people that have any, even minimal, COVID-like symptoms to be tested. So again, that symptom list is very broad. Nobody will be turned away. Our goal is to get people there that we can test and see what the spread of disease is in the community.
In terms of the 85,000 tests a week goal under the Badger Bounce Back, how long do you think it'll take to get to, this would be two parts, how long do you think it'll get to doing that many? And B, what about those who maybe initially test negative, and then, I mean, that doesn't mean they couldn't contract the virus, so doesn't that complicate things?
Yeah, that's good questions. So the questions are related to testing. Again, the state has set a goal as part of their Badger Bounce Back plan to be really ready for the capacity to move forward in reopening in response, to have 85,000 tests per week done, 12,000 a day. We are a distance away from that. And really, what is my opinion about how quickly we can get there? I know that the state has been full in working on this. We got emails last night at 10:30 from state EOC about our National Guard testing site, for example. This is an enormous priority of the state. We are understanding that they are putting full effort into making this happen, along with contact tracing, along with the other priorities, and they've pulled in resources, and they're counting on us locally to do it as well. I see that our local providers, we can't get to 85,000 unless every location, including Eau Claire County, is full in to get testing happening. So we are talking to them almost daily about increasing their capacity, and the conversations have been strong and positive, and they are doing what they need to do to get to that point. We are not fully there in Eau Claire, just like that's true across the state, but I see everyday progress being made. The second question, I should have had you...
In terms of somebody maybe test negative.
Negative,
that
thank you.
precludes the fact.
Yeah. So one of the things about testing, of course, is that you are tested at that point in time and told if you are negative or positive. If I get tested right now, I will know right now if I have disease. If I leave here and one of you is positive and I get exposed to you as I walk out the door, which I won't do since we'll stay 6 feet apart. But if I have an exposure tonight or tomorrow, I could be positive in a few days from now. So yes, a test is only for that point in time. Repeated testing may happen for individuals that have repeated exposure, but our goal is to make sure that exposures stay low so that, as we've regularly said, people being out and about where exposure might happen, physical distance is our best strategy, so staying that 6 feet apart. Wearing a cloth face covering when you are out and in situations where you may have exposure happen. Again, one person wearing a face cloth will protect others from their spit. Another person wearing a face cloth, both of you having them, is the best protection if you are going to be in close proximity. And of course, staying home for no exposure is the other way to not get exposed. But the more we can limit our exposure, the less likely we'll need to be tested and found out to be positive later. Yes?
We've gotten some questions regarding some of the golf course restrictions that are still in place even when the golf course is open. One of them being food and drink sold on-site cannot be consumed indoors, outdoors, or on the golf course itself. Obviously, the indoor, you don't want people gathering indoors, but on the golf course itself, is there a reason why the restrictions extend out onto, like, on the greens?
Sure. So the questions are related to golf courses, and I will have to have our team respond to the specifics about the golf course restrictions around operations. Again, our goal on all golf courses is to make sure that people stay physically distanced, that they are really staying with people that are in their household as much as possible, and that they get out and enjoy the golf course. But we'll follow up on the additional questions. Yeah.
At the beginning, you talked, it sounded like when you're out walking your dog, you ran into maybe a friend, either a friend who's a hairstylist or maybe your own, I'm not sure, but
My own.
what was her encouragement to you again? Because it seems to me, I'm hearing from those in the hair community a growing frustration, like they're frustrated that certain other folks have gotten deemed essential and they're still on the sidelines. So
Sure.
What's her message to you?
Yeah, so the question is really related to what I shared in the beginning, my personal story about encountering my friend and the person that does cut my hair, a salon person that has her own business. And the challenges of that. So it is extremely challenging for everybody in that industry right now, and in any industry where close contact is required. So those people that are in nail salons, those people that are in all of those service industries where they come in close contact with other people. So my message continues to be, and our conversation continues to be, that this is hard and we need to work together on safe reopening strategies. Containing the disease is our step right now to make sure that there's not spread, but certainly those situations where close contact is necessary, we are right now not at a place where that is considered safe by the state, and we're working hard to make sure that we quickly get to a place where that is possible.
Out of the 34 cases in Eau Claire County so far, how many of those have been hospitalized?
So the question is, of the 34 cases in Eau Claire County, how many of those are hospitalized? That is right now not information that I have, and for confidentiality reasons, not something that we are sharing readily. It's a data point that is available at the state level at this point.
Well, when Dunn County's rep was here, I mean, she shared about how they had, at one point, they had 9 cases, 2 of which were hospitalized. I just presumed that the same information.
Sure. Yeah, so again, the question is related to hospitalized patients. We don't have that information at this point in time. Certainly, we are working really closely with everybody that is identified as COVID positive, and the specific definition with hospitalization continues, frankly, to be a challenge. People frequently are in the hospital for brief amounts of time. They may come in through the emergency room and be discharged quickly. So part of the challenge with this is that until the state cleans the data and makes sure that it's truly a hospitalized patient, it's very difficult to share that. We know that there are people in the hospitals in Eau Claire as well that are not Eau Claire County residents, so that continues to be a really challenging data point in this area. We are working carefully with everybody that is COVID positive and making sure that they are isolated in whatever situation that they're in.
When we talk about flatten the curve, the point has been throughout, flatten the curve because we don't want to overrun our hospitals. You've said none of us have immunity, and likely along the way, you're going to get it, but you don't want to overrun it so fast. So how many with our medical facilities here, like what is the number we could adequately serve? You understand?
Yep, I understand the question. So the question is really related to one of the concerns, and one of the things we're preparing for is a large surge in disease. One of the reasons that we talk a lot about flattening the curve is to make sure that our healthcare systems are not overwhelmed. The reason none of us want our healthcare systems overwhelmed, we've seen the pictures in other countries and in other parts of the U.S., is that we need our healthcare system to be able to care for those that need that hospitalized care. And if there's too many of us that need it, we won't get it when we need it. So that's the idea behind flattening the curve. All of our healthcare systems are working within their system footprints to identify the current number of beds and reporting the current number of beds that they have available, as well as the potential of converting other beds if needed. So those numbers are readily available on the state website. That website fluctuates daily because some of those beds are used for other reasons rather than just COVID-19. We meet weekly, if not more than weekly, with those healthcare sites to make sure that we understand where their current bed capacity is, how they're planning for surge, so beds beyond their regular ICU or CCU beds, and they have a good number of those, and what we do when surge is needed in this community. So our estimations right now are that the need is going to be met if we keep the surge curve flat and as low as possible. I don't have the exact numbers, which I know is part of the question of what those beds are, but that's certainly something that's readily available on the website, the basic number. Each of those institutions is working with us and working with each other to identify where people could go if we needed that. And I'm confident that our system can meet that need. Part of the challenge is that we're a regional site, and we will not just have Eau Claire County residents in our healthcare system. So calculating volume of need is a challenge in our region, but something that all of them are working very carefully and collectively on right now. Any additional questions? Again, thank you, everyone. We appreciate people paying attention to what the information is that we have on COVID-19 as it rapidly changes, and we understand that that's a challenge. We'll be back on Monday to share with you updates of things that happened over the weekend, as well as updates from the state and local level on response. Thank you.